Another test for upper cervical spine instability is the modified Sharp-Purser test, which is going to be testing the transverse ligament of the atlas. What we want to do is we want to initially assess our patient's symptoms and ask them if they've ever had any subjective complaints of myelopathic symptoms while moving their head into flexion. If they have, that would be indicative of the modified Sharp-Purser test being positive, as well as the clinician wanting to establish that finding clinically in order to make the appropriate referral. So, what we'll ask the patient to do is to go into slight flexion at this point, assess for any symptoms. If there are none, what we'll want to do now is to identify the spinous process of C2. We're going to grab C2 and hold. Ask the patient to go into more cervical flexion. Assess for any myelopathic symptoms. If there are none, then what the clinician will then want to do is apply a posterior force through the forehead of the patient and again reassess for symptoms. If there were symptoms and this were to relieve their pain or their myelopathic symptoms, that would be indicative of a positive test. If so, it should be appropriately referred.